Hello, everybody. This is Brad Ayler, Dr. Ayler. We're going to be having a discussion today, or I'm going to be giving a webinar. I guess more of a webinar as opposed to a discussion, but we would like you to put any comments into the chat. Now, the chat is set up so that not everyone gets to see what you're saying. So it's kind of a private chat, but it is there. So please answer or any questions that we put out there, and also ask any questions or have any comments in there. We sure appreciate it. So our discussion today, or rather our webinar today, is the science behind stem cells. And there's a lot of science out there regarding stem cells. So it's really going to be an introduction to the science. We're first going to talk about what stem cells are. We're going to go into what the bench science is. So what has been studied in the laboratory and on, the petri dishes and the test tubes. Then we'll go into the concepts behind animal studies, and then we'll go into the human aspect. And all of this is to give you some understanding as to what's going on with stem cells and whether the use of stem cells might be applicable to you. Now, I need you to understand that I am going to gear this talk toward the use of stem cells in musculoskeletal medicine. There's people out there that are reporting they use stem cells for a variety of neurologic conditions like multiple sclerosis or Alzheimer's disease or amyotrophic lateral sclerosis, things like that. That's not what we're going to talk about. Although the bench science and some of the animal science, that will be applicable all the way across for stem cells. But we're talking about musculoskeletal medicine. So I'm talking about your joints, your muscles, your tendons, your ligaments, your bones, your skin, just the framework of your body. And that's what we're going to be talking about today in terms of musculoskeletal medicine. So we did have some polling questions up there and some survey questions. And I'd like you to take just a minute and answer those if you would. So the survey questions give us an idea as to what you would like to learn from the future in additional webinars. In fact, in 2 weeks, we're going to be giving a webinar on testosterone in women and talk about the science behind it, what the research has shown regarding it. Is it important? Is it not? What are the benefits of having an appropriate level of testosterone in women? And I am of the belief that hormones are extremely important in terms of how we function. They have an impact on everything that we do. And I do believe that having an appropriate level of hormones is very important. And so we'll get into that regarding testosterone in women next week, or in 2 weeks rather. But I want you to, if you put on that survey, other topics that might be interested, whether it's in a functional medicine approach, what you can do to be healthy in terms of this time with the COVID virus, what you can do in terms of um, uh, what we can potentially do in terms of regenerative medicine, whether it's stem cells, PRP, alpha 2 macroglobulin, what we can do in terms of taking care of your body and lifestyle changes. So I have a rather unique background, and I'd like to be able to share that information to you. And please feel free to share that with somebody else. And if this is a bad time to come on live, if you register for that and pass that on, and you let us know, we'll send you an email follow up and ask you if you want to get a copy of the link so you can sign into it and watch it at a different time. Though hopefully we're going to finish this within a half hour. Have you some time available to have put your questions in there in the chat and enter them in any time if you would, and then we'll be answering those and get you out of here. So I appreciate the being here to learn something about stem cells. So first of all, stem cells. Understand what is a stem cell? Well, to do that, we have to go to the biology. So when we think about the biology, we have a sperm, and then we also have the egg. So remember that the sperm and the egg have half of the chromosomes that we normally have of 46. They have 23, and then they combine. The sperm penetrates into the egg, and that DNA combines to make a full complement of the DNA. Those cells then start to divide, and it goes into from one cell, which was the egg with the sperm in it, it goes to 2 and to 4 and to 8 and to 16. And as they're dividing, they make a ball, they make this globe, but it's a solid globe. And on the inside of that, by day 4 and 6, those cells, when we talk about embryonic stem cells between day 4 and 6, that's when you're able to obtain an embryonic stem cell. Remember that egg and the sperm is now an embryo. It's going to become a human being in terms of human stem cells, any other animal species in terms of that particular species. So if we take the cells at that point, they're called the embryonic stem cells. As those cells continue to divide and they make a larger globe, a sphere, and then they become hollow in the center, and then the tissues start to develop way down the road. But after that initial period, say 6 days, but let's give it a few more days, then those cells have actually developed in what we call an adult stem cell. So the difference between an embryonic stem cell is an embryonic stem cell is pluripotent, which means it can turn into almost any type of cell that we have in the body. That means it can turn into your eye, your kidney, your liver, your hair, your toe. It can just turn into anything. But when it becomes an adult stem cell, then those stem cells are destined for a specific lineage. At this point, we have 3 different types of adult stem cells that we know of. The first one that we started utilizing back in the 50s and 60s was the hematopoietic stem cells. We find those in the bone marrow, and hemo means blood, so they make blood cells. All the different types of blood cells, and that's commonly used for transplantation for leukemias and other cancers of the blood. They also, at that same time, discovered another cell called the mesenchymal stem cells. And even though they've been theorizing that we have to have some type of a cell like this, it was when they first came across it back in the 50s. And then they also discovered the mesenchymal stem cell. Mesenchyme means origin for the musculoskeletal system. That means bones and joints and cartilage and ligaments and skin and fat. That's the mesenchymal system. And in the 1990s, they discovered another stem cell, and that was the neuronal stem cell. Even though there was a lot of debate, they finally agreed that there are neuronal stem cells, and that makes your nervous system. So the adult stem cell, theoretically, is geared toward making those specific types of tissue. Now, we don't understand, that doesn't mean that they can't turn into other cells, but we do know that they can turn into those specific types of tissue. Like I said, the muscle, the bone, the ligament, the tendon, the cartilage, the adipose tissue. And what we found from the bench science is that you could induce those cells to differentiate into those type of cell structures. So when we talk about the word differentiate, and that has a particular meaning that that cell can turn into any of those other types of cells that we just discussed. Once it turns into that cell line, it is locked in. It is going to be the cartilage. It is going to be the bone. It is going to be the skin or the adipose tissue. But before that, as a stem cell, it doesn't, it's not committed, let's say. So what happens with that stem cell is it can divide, and it can divide forever. It's an infinity cell. It's an immortal cell. It doesn't mean it can't be killed or it can't die, but it means that it can continue to divide itself into another stem cell forever, theoretically. Whereas a cell that is differentiated, say a cell that is differentiated into your cartilage cell, has a certain length of divisions that it can do. So one cell divides into 2 cells, and those 2 into 4, those 4 into 8, and that keeps going on. And when we consider that, wow, that ends up being a lot of cells. But remember that we lose cells all the time. So we're always replacing those cells. And when we have gotten to the point that we have um, gotten rid of all those cells, or those cells have done their number of divisions, excuse me. So when those cells have gone to the point that they have divided, say 35 times is what we're finding in the laboratory, that a cell will divide 35 times. And after that, it just stops dividing. It becomes what we call senescent. So it doesn't function anymore. It doesn't produce your hair. It doesn't produce your cartilage. It doesn't produce the collagen. It doesn't produce the bone structure. It just stops working and it becomes senescent. And there's some interesting science behind telomeres, and those are little parts on the DNA that have something to do with how long a cell is going to live, or function rather, before it stops functioning. That's a very interesting science as well. So that cell, as we said, the differentiated cell, say my cartilage cell, could go up to 35 divisions of that cell lineage, and then it doesn't work anymore. It stops functioning. But we do have these stem cells that are in our body, and those stem cells have the capability in the laboratory. What we found is that they can be stimulated in a certain environment to now turn into or differentiate into a type of a cell. And they can differentiate them into cartilage, they can differentiate them into bone and skin and adipose tissue. And it depends on the environment in that area, in the test tube or in the petri dish. And it depends on the structures that are around it and the nutrients that are there. We are able to, it's been demonstrated, there's no question about that they can do that. The question is, what are all those structures in our body that can do the same thing? And it came out to find that the platelets in our body, and we remember the platelets are those things that you're taking aspirin for. The platelets clot your blood. So we have white blood cells to fight an infection, red blood cells to carry the oxygen, and a platelet is what clots your blood. Well, think about that. When you get injured, there's usually some bleeding. And the bleeding is somewhat of an indicator as to how well you're going to heal. If you cut your arm, or if you have a vascular problem, say diabetes, and you don't have good circulation in your feet, you cut your foot, and there's no bleeding, it's not expected that that wound is going to heal very fast at all. But why is that? What is it that the blood does? Is it just that it's carrying oxygen? Well, it seems that it's more than that. The blood, when there's an injury, the platelets are released to that area to stop the bleeding. When those platelets coagulate or stop the bleeding, they release a variety of granules from the platelets, and those granules travel through the blood system to activate the stem cells, because the stem cells line blood vessels. They're throughout the body, they're everywhere, but they seem to a nice transport system, which means that the chemicals are released from the platelets, enter into the circulation. They go into that through the circulation. They stimulate those stem cells. Those stem cells detach from the lining of the blood vessels and travel to the area where there's an injury, and there's chemical structures that are saying, come here, come here. It's kind of like the alarm system, and those cells start to work. So what we know is that cartilage cells need a low oxygen tension state, which is perfect for your joints, right? I mean, remember, our joints do not have blood flow. So we can show that we can make cartilage in the lab by reducing the oxygen in the area and giving them the other nutrients, etc., to make those stem cells work. But think about it. How do we get those stem cells to function or to work in your joint if we don't have blood flow in your joint? Remember, our cartilage is in a vascular structure. So, and tendons, for the most part, Remember, when you cut a tendon, there's not very many blood vessels. And those are two reasons that those structures just do not heal well, because they don't have good blood flow and they don't have ready access, in my opinion, not only to the oxygen and the nutrients because of the blood flow, but also to the stem cells. So in the laboratory, what we found is that those stem cells can be created. They can actually take the cells, create them, and they have different markers on the cell to determine what those cell types become. So they can tell if it's going to be a bone cell or a cartilage cell or a skin cell. And there's no question that in the lab that we can make cartilage, that we can make skin and bone from these different types of stem cells. Now, where do we get those stem cells? Well, like I said, they're throughout the body. But one place that we have a lot of stem cells and where it was first discovered was going to be your bone marrow. And that's the great place where you're going to get your bone marrow makes your blood cells. That's how you get your blood cells. So your bone marrow is where all your blood cells come from. And that's where your hematopoietic stem cells, and we find that the mesenchymal stem cells are there as well. But we found over the last, maybe 15 years, that we also have a significant number of stem cells in our adipose tissue. Adipose tissue is our fat tissue. It's not in the fat, it's in the blood vessels surrounding the fat. So when you think about it, every fat cell that takes the triglycerides, the fats that are in your blood. Remember, you have triglyceride when you eat, the liver makes the triglyceride. It attaches to a protein, and then if you're not going to utilize it, it stores it into a fat cell. But we have to have this complex structure of blood vessels around every one of those cells so we can get that triglyceride into the fat cells. So all those blood vessels, the number of blood vessels there, all have stem cells. So it makes it a great environment to obtain the stem cells from your bone, from your adipose tissue. And in doing that, we're not harming you. We're not taking off your leg to fix something. We're just taking some fat. And then we find that in the laboratory study, in the animal studies, that they've taken and how they move around as well in an environment. They've taken a dog, say, and it's had an injured front leg, and they've taken some stem cells, and they know that they've stem celled from a female animal, and they've concentrated those stem cells. They've grown them so that they have enough, and they radio label them, and then they inject them into the hind quarter of the male dog that has an injured front leg. And they follow those cells and they see they show up because of the radio label. They see that they showed up at the wound site. So now they incorporate into the wound site so that we know that they travel. And now we have figured out that it's the platelets with an injury stimulates those cells to travel to that area. And then we find that those cells start to incorporate into the injured structure, into, say, the bone that's been broken. There's something to say about the stem cells. Like I said, we know from the laboratory that a stem cell can differentiate into, say, a cell. And then that articulating cartilage you have in your knee, you're not sitting on the cells. What you're doing is sitting on the cartilage that the cell makes. So the cell is a factory and it makes the collagen. And as it makes that collagen and lays it out, there's a certain amount of volume that collagen that a cell can make. It's kind of like putting your sprinklers on. You put your sprinkler on, you have to put a bunch of sprinklers to cover your yard because it covers a certain distance. Well, that's just what this cartilage cell does. And so it is able to accomplish that. If we have one of the sprinkler heads go out, it's like a cell goes out, we have a dry spot, well, the cell has to divide and migrate a cartilage cell to that area, and it starts producing the collagen, and we keep that height of our cartilage. So say our cartilage is this high. When it gets down to this high, it's because we've lost the cartilage cells. And now it doesn't have the capability of regrowing and getting us up to this point. This is where we are. And as we continue to divide, or excuse me, as we continue to wear that away or with time, it shrinks down more. It shrinks down more. And as long as you have some cartilage onto your joint, it's kind of like ice on a pond. You can do great with your ice skating until the ice melts. And it doesn't matter if the ice was this thick or this thick, you're fine skating around as long as they're ice. But once you've lost that ice, you're going to stop pretty quick on that gravel. Well, that's what your knee does. So the science has shown us through the animal studies that the stem cells can migrate to an area and they can incorporate into the graft. The bench science has shown that we make cartilage. The animal science has shown that we also make cartilage, that we can make cartilage in those joints. But there's another consideration or another factor that has been discovered as well. Just as I said that those platelets have that capability of releasing these granules that stimulate the healing process to occur. And those granules contain various substances like transforming growth factor or platelet derived growth factor or fibroblast growth factor, vascular endothelial growth factor, a variety of growth factors that stimulate the healing. Well, inside that stem cell, it also has what we call exosomes. And those are particles that stimulate the environment. And we find that those particles can stimulate those cells that we said have become senescent to start working again. We don't understand how this works. We just know that in the laboratory and when we're looking at the results when we're doing studies on animals, that those stem cells releasing the exosomes have effects on the entire surrounding area. So it doesn't have to only affect the cartilage, it can affect the other tissues. And that's where we consider, at least in my mind, the question is how would a stem cell, with our current level of understanding and the science, understand that this is going to change with time? If those mesenchymal stem cells make those type of structures, how can a stem cell help a nerve or how can a stem cell help the other things? And it may be because those stem cells release the exosomes and those exosomes have an effect on the other cell types and cell structures in the area. So what do we know about stem cells in terms of what they do for us? Well, how the body, we know, what we know is that they take away your pain. Most of the time when we've done a procedure on someone, their pain is usually what limits their function. Going up and down stairs, they have a difficult time standing, they have a difficult time doing exercise and activity because of the pain. So it's easy for me to say, yep, they took away the pain. What we don't know for sure is, are they repairing the cartilage? Are they altering the environment down there in some other way? And the we would have to go in, you had a stem cell, say a procedure to the knee, then we have to go back into the knee and biopsy the tissue and see if we have new collagen. And most people don't want to do that. So unfortunately, because people don't want to do that, we can't say 100% for certain in the human population that we are making cartilage, although there are some staining studies that suggest that we are making cartilage. But we certainly see that in the rabbit and the pig and the dog and the mouse, that we are indeed making some additional cartilage there. And we actually have seen arthroscopic studies where you'll go back in and look at the area and it does look like it's smoothed over. But I can't necessarily guarantee you that that is what it is. And as a result of that, the FDA has said you can't say that you're going to necessarily rebuild the cartilage because you can't guarantee that because you can't determine that for sure. It's kind of like when you take a medicine, Notice they are always talking about you're dealing with the symptoms. You're we're treating the pain associated with the arthritis, but we're not saying you're curing the arthritis, you're curing the eczema, but you're getting rid of those spots. Well, in some way, that's what we're also having to say with our stem cells. Understand the second thing that when we are taking your stem cells, we are also taking a variety of other cellular structures in that same milieu from what we're obtaining, either the bone marrow or the adipose. So instead of, it's probably a better word that we're going to be using more and more, you're going to see it, that we're talking cellular medicine and orthobiologics as opposed to just stem cells. Stem cells is that key word everybody understands. But truly, it's the orthobiologics because we don't know all of the other structures, chemical structures that may be affecting the healing and the growth, but your body does. It's been doing this for millennia and as long as you've lived, because every time you've been hurt, your body has this ability to repair, to heal, to restore, and regenerate an injured or damaged tissue within its capabilities. So it's now 30 minutes, I think. And so I, I am going to see if there's any questions. And if there are, we'll go ahead and try to take that. So, how do we get the stem cells? And that's a great question. So, now that you gave me a little in, I'm going to tell you a little more about the stem cells. As we get older, we know that we're just not as vital as we were before. And the research has shown that the bone marrow, which we said is a great place to get the stem cells, that the stem cells in the bone marrow seem to age a bit more. So we lose a certain quantity of stem cells in the bone marrow as we get older. In the adipose tissue, it doesn't appear that that's what happens. With time, we don't lose the same amount or that those cells don't lose their vitality in the adipose tissue as much as what we do see in the bone marrow. And there does seem to be some correlation between the number of cells that you get and the effect of those cells into the body. So what we do is we do a simple liposuction, and I will often do adipose tissue, and we'll do bone marrow as well. But for the adipose tissue, we numb the skin. We simply put a small, like an 18 gauge needle into your skin toe just to make a little hole. And then we put a blunt instrument in there that we inject some fluid. We call it tumescent fluid, which kind of just lubricates and bakes the fat more of a liquid type of material that we can suction that out with a very minimally invasive and non-traumatic way. And then we harvest those stem cells and then we process those stem cells right there at the site. With the bone marrow, and when I say the stem cells, I should say cellular structure. It's actually an adipose graft. It's actually in there was stem cells that seem to help in stimulating the healing response. In the bone marrow, we do the same thing. We simply, on your pelvis, the thick pelvic bone that you have, we simply numb the skin and we place a probe through the bone and then pull out some of the bone marrow. And we utilize that for the stem cells. The recovery time after stem cells. Now, there's two kinds of recovery time we can talk about. One of those recovery times is how long does it take for the stem cells or for you to have an effect of it? And the other consideration is what is the time that you're down following a stem cell? Well, it depends on the severity of your condition. Remember, this is different than we're talking about a total joint replacement. On a total joint replacement, basically you want to just endure it as long as you can, because the longer you have that joint replacement, the expectation is that you will have a second joint replacement. We see that joint replacements might last 20 years, they might last 30 years, they might only last 10 years, and there's significant amount of evidence suggesting that maybe 10 years or 12 years or 15 years may be the length of time that a joint replacement lasts until you get a new one. But it all depends on the type of the joint, your body, the health of your body, etc. But when we're putting a stem cell in there, we want to do it earlier than later. Because if you have some cartilage there, then we can be much more aggressive with allowing you to do your normal activity. It provides some nutrients and some cushioning, etc. If you're very severe in the arthritis, we may limit you a bit more. So in general, we get somebody crutches so that they're not putting full weight bearing onto that area until they have a normal gait pattern. And once you have a normal gait pattern, you're fine to go off the crutches, unless there's a more specific event. And so we're usually talking on the crutches probably a week or less, and then getting back to your activities as long as it's not causing pain as soon as you can. And that's oftentimes what we're finding is about a week or so. That doesn't mean that the stem cells have completely replenished and regenerated the tissue. That takes months for that to occur. But it seems that the adipose provides some cushioning in there, lubrication in there, kind of like that support for the structures to start to heal and to grow, and the impact of the stem cells, whether they are directly turning into cartilage or they're influencing the other cellular structures to work. Okay, so basically you're not on crutches very long. You're back to your activities. But if you're having a very severe joint condition, and it depends on which joint, we may have to limit you a little longer than that. You're always going to have to be doing some exercises, because what's also important is not simply that we're putting the stem cells in. What we want to know is how you ever got there in the first place. Why is your joint wearing out? Is everybody in your family, all their joints wear out? Or did you have a specific trauma? Did you have an event? Do you have an abnormal gait? Are your muscles weak? Are your ligaments tight? What's going on? So we want to evaluate that, and we do that prior to doing the stem cells so that we can identify what are the underlying factors contributing to your condition, and we can address that. And we set you up with that kind of a program to help you with that. So one of the questions is, what needs to be done before stem cell therapy is better recognized? Well, it's an interesting concept. Probably if a big drug company got behind it, it would. And I don't mean to be so rude about it, but this is your own body's tissue. And as your own body's tissue, you cannot patent it. So a significant amount of research that is done for stem cells is not done just to see what your stem cells are doing. They're trying to make other components, scaffolding and other things that may have an influence on the stem cells. Because now you can patent that. You can patent another process, but you cannot patent a stem cell. So we do not have large randomized controlled studies of 2,000 people going through a certain process. We have smaller studies. We do have studies that show over 1,500 people and 1,800 people in a study demonstrating that it's extremely safe, but we don't have those studies that are showing that we've done this many people and we've done this specific technique and we've gotten this specific outcome. They're smaller studies. But it's kind of like CoQ10. Now you're seeing on the TV a lot of information about CoQ10. And if you don't know what CoQ10 is, CoQ10 is it's a molecule. It's kind of like a vitamin, but it's not. It's CoQ10, ubiquinol. And that is in our energy making system in our body. In every cell of the body, we have something called a mitochondria, and they use CoQ10 to make energy. And we know that a statin blocks your ability to make CoQ10. And in Europe, for years, it was required that if you're writing a prescription for a statin drug, you also had to write CoQ10. But we never saw that at all. But now somebody, a nutraceutical company, is advertising their CoQ10, and now everybody knows about CoQ10, even though we've been talking about that for a long time. So that's my uh, that's my comeback. But probably the one reason, the way that we're going to be able to get that word out and have it widely acceptable or accepted is that we're going to have some big company do it. As it is right now, it's all something that is based on what you're paying for. Insurance companies are not covering this. And so that's led a lot of people to have this consideration or concern that somebody's just kind of stepping out of the bounds. And there are people that are stepping out of the bounds. So when you talk to somebody, you come in, you visit, you want to have that discussion about what's going on. And we encourage you, if you have an issue, come in and visit with us. And we'll talk about whether you're a candidate. We'll tell you about what the expectations are. We'll talk to you a little more about the science. And then we always go over what are the factors that have brought you to this specific state, this condition, because that's just as important in my mind. Not only do we want to help repair and repair the cartilage or get rid of the dysfunction, but we want to keep that system working well for a long period of time. So one of the questions is how does the stem cell know whether to turn into a cartilage cell or a bone cell? Well, as we talked as I said to the discussion, we found that a low oxygen tension state is really what seems to be important for cartilage. Tension state means a place that does not have good blood flow, which is your cartilage, and that makes a lot of sense. The other things, however, it seems that when we have an injured tissue, that tissue somehow puts out a signal that indicates that, hey, I've got damage. And there is this cell to cell communication. And to be honest, that's one of the things that those exosomes do. In our body, there is a communication between one cell and another cell. And that's usually by producing an exosome that is released from the cell. It contacts another cell, it's engulfed in the cell, and it sends a specific message to alter how that cell works. It's fascinating. This whole environment behind it is just incredible. Truly, when it comes back to that statement, and I think Albert Einstein, he was quite a philosopher, and I'm going to paraphrase this, and he said there's two types of people. There's one type looks at the world as though there are no miracles, and the other looks at the world as though everything is a miracle. And to me, in medicine, even though it's science, we have these conflicts and people are thinking about science as being so direct, and especially in this COVID virus situation, if you don't question science, you ought to, because it's all, even though we do have science, we see certain informations from a study, we do bench science on stem cells. It's how somebody interprets that directives, and it's that is considered to be science, whereas it's what happened in the test tube. That's the science. And then the rest, the interpretation, we say that is the science. So the last question is, what kind of success do we have with this? Well, it depends on what you call a success. Every time when we do a procedure on anyone, the question is, did you get 50% relief of symptoms? Are you back to running a marathon? Say, if you've had a difficult time going up and down stairs, and suddenly you say, geez, now I want to go out and I want to do all the things I did when I was 20 years old. Well, your joint may be able to handle it, but the rest of the body may not. You may have a heart attack, your ligaments or tendons or whatever. What I can say as far as the pain goes, because if somebody had pain in their joint, they couldn't go up and down stairs because of the knee pain. And we do the stem cells. I would say overall, even with very bad knees, that all except for a few occasions, we've had improvement. And in the great majority of those people, we've had marked improvement. They're able to go up and down the stairs. They're able to function. They're able to do the things that they've been wanting to do. I saw somebody the other day, and it was on an airplane, and they came on the plane, and I looked at him and said, "Boy, you look familiar." And then we sat down, and she said, "Oh yeah, you did my stem cells." I was like, "Oh geez," and that was over 3.5 years ago or so. And she says, "Yeah, I'm 70% better. I'm going up and down the stairs. I'm not having the other." That was anticipating that she was getting ready to have a joint replacement. Now, the earlier we do it, I think that the success is going to be better. The later we do it, we may not. The difference between this and a total joint replacement is we can always repeat this. So if we do a stem cell, we alleviate some of the discomfort. You're functioning, you're getting better, the symptoms start to come back. We can always repeat it. It's important, however, to be mindful as to the various factors that let you get there. Just like we have a cognitive program, and we have a program, that cognitive program is for people to do all that they can do to make their brain function as well as they can. So we help you get that cognitive function back. Well, that's kind of a lifestyle. That's what we want you to do for the rest of your life. We want you to do certain exercises for the rest of your life. We want you to do certain activities for the rest of your life. They're not hard, they're not mean, they're not overwhelming, but they just help maintain your structure. So the bottom line is the great majority of people that we do the procedure on get significant benefit. We can't guarantee it. It depends on many factors. Remember, it depends on you. How is your health? How bad has it gone? The procedure itself that we're working on, how we do it with the technique. I do have to say that whenever we are doing stem cells, we are always adding PRP. There was an article I just read yesterday morning discussing about the importance of how they did this study. It was on an animal study. Again, it was for pressure ulcers. It didn't have anything to do with the bones, the joint, but it looked at pressure ulcers, which is an ulcer that develops, say, for somebody that has a spinal cord injury or somebody that's debilitated, they're in bed, your skin breaks down and it dies. And that's a very difficult situation. So what they did is they took human stem cells and they injected them into the area that they created pressure sores on, say, a mouse model. So human stem cells on a mouse model. And then they also added the PRP. And when you added the PRP, the response rate was significantly better. Because remember, the PRP kind of turns it on, it kind of activates it. So I hope I didn't get in too much depth that I lost you. And I hope that you got something out of this. And please let us know what you got out of it, what you thought was good, or what you would like to hear more about. I'd appreciate it. If you have any questions or any concerns about your joints, things that we do, I'd like you to come in and make an appointment. Again, we see people with conditions, backs, necks, knees, ankles, shoulders, things like that. We do stem cells more so on the peripheral joints. We do a variety of lifestyle medicine, and we look at your hormones as well. So it's a practice. What we're trying to do is restore you to your optimal level. We want you to live this life fully, vitally, with vigor, keeping your mind, keeping your sexuality, and just enjoying life. So I hope you enjoyed this. Let us know. And thanks again for coming.